Hello students, I am Dr. Deepika Aggarwal, Professor in the Department of Community Medicine, Santosh Medical College. Today I will be talking about universal health coverage in India. The outline of this lecture consists of what is universal health coverage, what are the essential conceptual frameworks to understand the universal health coverage. That is the disease burden which has changed and is continuously changing. Also, we will address the health needs of the whole population and from prevention to curative care, that is from home to hospital care. So these are the essential conceptual frameworks that we would be talking about in this lecture. As you already know, universal health coverage is not new in India. There are several health milestones in India starting with 1947 when the Bhor Committee report was accepted. Then in 1978 the Alma-Ata Declaration of Health for All was enacted and the country started working towards providing health for all. In 1983, the first national health policy was adopted by India, in which the health for all framework was there and strategies were included to provide health for all in the country. In 2002, second national health policy and the national population policy were adopted. In 2005, there was the launch of the National Rural Health Mission and now the National Health Mission 2013. In 2008, there was the launch of Rashtriya Swasthya Bima Yojana. In 2011, the Planning Commission report on universal health coverage was submitted to the government, to the Health Ministry, and in 2018, as a part of universal health coverage to reduce the out-of-pocket expenses, Ayushman Bharat was implemented, which is a national health protection scheme, and also under it there are health and wellness centers through which universal health coverage is being provided. Now, as per the World Health Organization, the World Health Organization says that health is a fundamental human right, and the Health for All agenda was set by the Alma-Ata Declaration in 1978 itself. So the universal health coverage cuts across all of the health-related sustainable development goals and brings hope of better health and protection even to the poorest in the world. Now, what does it mean, or how is universal health coverage defined? So, universal health coverage is defined as ensuring that all people have access, that is equity, and they should have access to needed health services, which would include prevention, promotion, treatment, rehabilitation and palliation. These health services should be of sufficient quality to be effective, and while also ensuring that the use of these services does not expose the user to the financial hardship. So, the universal health coverage should include equity, that is equitable access of all needed health services of sufficient quality without exposing any financial hardship to the user. So these are the components of universal health coverage. Now, how is universal health coverage in India defined? Please make a note that the universal health coverage in India means ensuring equitable access for all Indian citizens who are resident in any part of the country, regardless of their income level, social status, gender, caste or religion, to affordable accountable and appropriate, assured quality health services, that is promotive, preventive, curative and rehabilitative services, as well as the public health services, addressing the wider determinants of health delivered to individuals and populations, with the government being the guarantor and enabler, although not necessarily the only provider of health and related services. So here you see that even in India, the universal health coverage is defined as ensuring equitable access to affordable, accountable and appropriate services, healthcare services having assured quality, addressing the wider determinants, and the government being the guarantor and enabler of these health services. Now, what are the 10 different principles which are guiding the universal health coverage in India? So, first is universality. So, as I said before, it is ensuring universal access. So, universality. Then equity, it should be distributed equitably, irrespective of the financial status or socio-economic status of the individual. It should have non-exclusion and non-discrimination. There should be comprehensive care that is rational and of good quality. There should be financial protection. There should be the protection of patients' rights that guarantee appropriateness of care, patient choice, portability and continuity of care. Consolidated and strengthened public health provisioning, accountability and transparency, community participation and putting health in people's hands. So these are the 10 guiding principles of universal health coverage in India. Now, what is the vision of universal health coverage? How are we planning to achieve it by 2022? So, first of all was the entitlement, that universal health entitlement should be for every citizen. Second is the national health package. So, there should be guaranteed access to an essential health package like primary care, secondary care and tertiary care levels to all the citizens. And it should be an integrated healthcare delivery which should be provided by the public sector facilities or contracted in private providers as well. So this was the vision of providing the universal health coverage. First of all, the entitlement, then the national health package and the integrated healthcare delivery model. What are the expected outcomes or benefits of universal health coverage in India? First of all, greater equity was to be provided. It improved the health outcomes of the population. There is an establishment of efficient, accountable and transparent health system. It reduced the poverty by reducing the out-of-pocket expenditure. There is greater productivity since each and every individual is having access to quality health care. Increased jobs, because we are expanding this universal health coverage, so it is going to increase the job opportunities as well in the health sector. There is financial protection, as the government is the guarantor of universal health coverage here. So these are the expected benefits of the universal health coverage in India. Now, what are the three dimensions of the universal health coverage? The first dimension is the population dimension. That means we have to ensure that equity and accessibility is there. Then the health services dimension, that means what type of health services are covered at each level. that is the primary care level, the secondary care level and the tertiary care level, and how these services are being delivered. And the third is the financing dimension. Who is going to provide the financial component of these healthcare services? Is it the government or the private providers or the patient himself? Now, as you see that universal health coverage in India is being implemented by government or the healthcare, the public healthcare sector becoming the guarantor. So, this is to reduce the out-of-pocket expenditure, and the famous WHO cube that elucidates this very well. However, please go through, you can search this universal health coverage cube by the WHO on the internet, and in this cube there are 3 dimensions which are considered, and these 3 dimensions are the population, the services and the costs involved. Now, as of today, India has made substantial progress as far as health is concerned. If we look at the data from 1990 to 2016, we see that the under 5 mortality rate has decreased from 126 to 43. Now, please pay attention, the data is compared between that of 1990 and 2016. So, the under 5 mortality rate in 1990 was 126, while in 2016 it was 43. Considerable reduction was achieved. The number of under 5 child deaths were reduced from 9,304 every day to 2,962 every day by 2016. The infant mortality rate was also reduced from 88 in 1990 to 35 in 2016. Similarly, the neonatal mortality rate was also reduced from 57 to 25, and the maternal mortality ratio was drastically reduced from 560 to 137. However, the progress in the health is not commensurate with India's economic, pharmaceutical manufacturing and technology progress. We have progressed in these fields a lot, and we are yet to achieve some of the goals in health. Health sector is lagging behind in application of technology, and how the technology innovations in India can help accelerate its progress in improving health. So technology should go hand in hand with the progress in healthcare sector to improve and achieve the goals as put forth in the Sustainable Development Goals. Now, you must be aware, or you must have reflected, if not till now, you should reflect now after this lecture, that the life expectancy, you must have observed it also, the life expectancy in India has increased by almost 10 years in the last 25 years. The life expectancy for women in India earlier was 59.7 years, while as of today, that is as of 2020, the life expectancy was for women was 71 years. The life expectancy for males in 1990 was 58.3 years, while as of today it is 67 years. So you can see that there is almost a leap of 10 years in the life expectancy of both the males as well as females. Similarly, the disease burden has also changed. Earlier, there was a considerable proportion of infectious, communicable and diseases related to maternal and neonatal age group, while there was a lesser proportion of non-communicable diseases and injuries. But with the progress in the country at all levels, be it the progress in infrastructure, the progress in the financial status, the progress in the economy, So the the progress in urbanization, the shift from rural to urban areas, the setting up of industries, all these things have led to an increase in the non-communicable disease proportion now. In 1990, the communicable diseases amounted to 53.6% of the total number of diseases, while in 2016, the communicable diseases are only a small part, that is 27.5%, so they have been cut from half to one-fourth. While the proportion of non-communicable diseases has considerably increased from 37.9% in 1990 to 61.8% in 2016. And it is increasing because of the changing lifestyles, because of urbanization and so many factors. So, how do we propose to provide universal health coverage in this changing scenario of healthcare delivery and the health requirements of the people? So, first of all, we need to change the approach. The approach is that of whole of population should be covered, first thing. Second thing is that the interventions should be revised. The interventions that are covered under the universal health coverage should be revised, keeping in mind the demands of the population today. In the whole of, I'll just explain the whole of population approach. It says that healthy population without any risk factors or diseases should also be covered. The population with risk factors should be covered. The population with disease but who are not aware that they have the disease, specifically meant for non-communicable diseases, should be covered. And of course, the population who know that they have a disease and require treatment, they have to be covered. So all sectors of the population who have the disease, who do not have the disease, or even the risk factors, every aspect, every level of the population should be covered under the universal health coverage. Now just a little reference to the out-of-pocket expenditure, which has increased. Now I have a comparison before me of the expenditure between 2004 and 2014. So within a span of just 10 years, the out-of-pocket expenditure in both rural and urban areas has increased a lot. While it was almost approximately 3,000 in 2004 in rural areas, it rose up to 5,500 in 2014. And even in urban areas, the average medical expenditure per hospitalization was around 3,800 in 2004, which rose to 7,500 in 2014. So almost all the aspects of medical admissions, medical expenditure saw an elevation, saw an increase in the last 10 years. So, in order to provide all these coverage in terms of population, in terms of expenditure, in terms of the health services, what our health ministry has done at present is that they started the Ayushman Bharat or the Jan Arogya Abhiyan. In this Ayushman Bharat Abhiyan, health and wellness centers have been established. These health and wellness centers are at the level of the sub-center as well as the primary health centers, and there is a specified package of services that has to be delivered through these centers to all strata of the population, even those who do not have any disease or any risk factor, to those who have the disease, know that they have the disease and require treatment, and to look after the out-of-pocket expenditure to take care of that. The National Health Protection Scheme was evolved or was implemented under the Ayushman Bharat, which provided coverage of almost 5 lakh rupees per family to those who are below poverty line, and certain other criteria are there to choose the beneficiaries. So Ayushman Bharat scheme was implemented to provide universal health coverage and reduce the out-of-pocket expenditure in India. That's all for today, students. Thanks a lot.